Well, as they always say, they save the best for last. We had a very robust discussion about our question of targeting stakeholder perspectives in communication and outreach efforts. And we identified lots of different stakeholders, including consumers, as a part of our dialogue. And so we had equal input by all the committee members. And here are the thoughts that sort of came across at the end. So the first question is, who are the important stakeholders and to engage in communication and outreach efforts about the need for credentialing research and credentialing impact? And we began by this notion, having this notion of we're really talking about engaging individuals about what's the public good answer about this issue of nurse credentialing and in conducting research on nurse credentialing. So from that perspective of what's the public good answer, the you have to look at it from the idea of, well, who's engaged in that public good? And certainly payers are. So they were the first good. And when we talk about payers, we're including the public, the federal government, state government, as well as the Blues and the Uniteds and everyone else. They have a lot of skin in the game because they're responsible for paying most of the healthcare costs in our country. And if we believe, so we're going in with this concept of this is for the public good, then they should have some interest in finding out what's in the best interest of the public good. So that's a stakeholder group that we said was absolutely essential that they be at the table and that we find ways in which to engage them. And then the second group, because they continue to be the largest group of engaging nurses who are credentialed and those who are not credentialed, are employers. And employers is, again, very broad. It's not just employers of acute care nurses who are certified, but employers of nurses in community health settings, in long-term care, in school health, in all the various areas where nursing practice. Those employers, having had the major investment of paying salaries, want to get some return on that investment and should have an interest in the whole notion of if I'm going to determine the allocation of my human resource dollars, if I'm going to invest in making sure that my staff, have perhaps access to programs to stimulate their interest in becoming certified. So there's all kinds of programs out there, not just studying for the exam, when I say, prep programs, but really, sort of igniting the interest of wanting to expand one's ability to deliver the absolute best care in whatever venue that best care is delivered. So having that type of investment. And then if I'm going to go even further and say it's worth this amount of money to me in terms of my annual human resource wage budget, and that might include everything from having salary differential for nurses who are certified versus nurses who are not certified, and being able to put something on there in terms of even investing, having the human resource department working with nursing and performance improvement to be able to answer the question first myself, just in my own organization. If I'm investing in it, what's the return on investment? So getting employers engaged is as an important stakeholder group. But we want to start off from the start. So individuals who are coming into the profession, we want them to know this, we believe that it's important that they know that graduation is just the beginning of the journey. And along that road, that students coming in and setting that expectation that you are about a journey of lifelong learning. There's some thoughts that becoming certified in a specialty area or more than one specialty area. We didn't address that question, but that's a question that should be over there. there, is there any value in having more than one certification? You know, oh, and that should be part of the research questions. Uh, but this whole notion of engaging the students from the beginning of coming to school, we heard today in our group and heard in our yesterday that students were not being aware of certification, and so if we don't set the expectation as a profession, then there's not going to be this engagement about that. And finally, and we believe that the group that has a potential for a lot of influence in terms of stimulating the interest in credentialing is the National Council of State Boards of Nursing, because they have that big club called licensure. And if they were to tie that big club to this notion of I'm going to use a term, and I don't want you to groan, differentiated practice. If there is truly, a differentiated practice according to whether one is certified or not certified in terms of their use of evidence-based practice, should that be in part of what they look at in terms of licensure and relicensure, not just licensure, not just the initial licensure, but is there an opportunity for us to potentially influence the National Councils of State Boards of Nursing to sort of take this up? And then risk managers, so if there's, we heard yesterday about some evidence, as Patrick gets up, he suggested to us that we should try to be looking for all the evidence, but there are some inkling suggestion that if you have a more competent and beyond base competency, which is what licensure provides, if you have a more competent workforce that is using the best practice, that's staying on top of the game in terms of their professionalism, that you could reduce the risk associated with adverse outcomes. And that has a dollar value to it. So it gets back to follow the money. If organizations could be engaged to have their risk managers be a part of the efforts that we take on in terms of creating, not creating, but illustrating the impact of credentialing. So we had lots of other different groups, but those were our top 5. We were not skunks like Bob and Jack. We kept to the 5. Okay. The next, just kidding. The second question was what strategies could be used to engage these different stakeholder groups, and the number one strategy is that we think that the standing committee that has been convened should become that circle caller. So circle calling is an ancient way of, whenever there were questions in society that needed to be resolved, you call in the community together. And so we think that this committee should do some circle calling, Dr. Berkowitz. And they should, the purpose of inviting these stakeholders is to inform them about what you're doing, but also to query them about what they see as the value of having a certified nursing workforce, and what they might help to us come up with why it's important to engage in them and the workforce in this effort, and to ask for their support. So do that convening of that broad stakeholder group, certainly that 5, probably some others that, since you made us go to 5, we didn't include those consumers, but we think you should include those consumers. So call the circle, and before your standing committee work is over, please do that type of convening. The second is that we think a broad-based promotional campaign about, is your nurse certified, that's aimed at the general public, and what that means. Take on J&J, ask them to expand, their still very public campaign. Perhaps there are others who will be engaged in that type of promotional campaign work. But it is about, getting away from our own navel gazing about nursing, looking at nursing, to gauging those who would benefit from our services in terms of certification. So have a public campaign out there about try to increase the demand for certified nurses by consumers, by employers, by others. And then the third was the need for a standardized taxonomy, because we kept hearing some nurses, when you ask them if they're certified, they go to, yes, I got a BLS card or I have an ACLS card. And there's still a lot of need for us to be very clear about what we mean by certification. So we need to get that out there, and that's something we believe the committee could do in a variety of ways. And perhaps the group of certifying bodies could come together and do it, again, outside of just nursing understanding what it is, but others. And then we need to engage risk managers, because they got deeper pockets than nursing organizations, and true. And they could be very important supporters in terms of getting out the message about why we need to not only promote credentialing, but why we need to do some research and get some answers about its value. And then again, going back to this notion of engaging students, is that we need to support transition into practice programs, as the IOM study on the future of nursing recommended. And these transition into practice programs, whether they call it nurse residencies or not, have it as one of the outcomes, that when you're in a transition to practice program, you're not done when you get through that 6 months or first year. You're not done until you get certified, so that it's a part of a pathway to certification for all the various transition into practice programs. So with that, I'd ask my group if there's anything that I left out in our discussion. Okay.
All right, let's open the floor to questions. Yes, please.
Hi, Shannon Carter, CCI. We're the Certification Board for Operating Room Nurses. Just to make sure the record reflects, there actually was a promotional campaign done called Certified Nurses Are Everywhere, and I believe it was headed up by the NCC, and several groups, mine included, participated in that. So there is a nice campaign. A colleague of mine was actually walking into a shopping mall and saw the poster related to that campaign in a local shopping mall. So I would suggest that any strategy that looks at promotion takes a look at that campaign and considers how to maybe leverage that investment.
Good suggestion. Yes. We have Marla. Yeah. And we have another question also. Go ahead, please.
Thank you. Marla Weston with the American Nurses Association. As I've watched the standing committee work over the last year, I've really tried to make a distinction in my own mind about promoting certification, which is kind of what this campaign is about. And I think some of the discussion that appeared to happen in this group was about, and promoting certification research. And I'm curious about, particularly for framing question 1, about some of the stakeholders, if there was any discussion about targets for certification research in particular, like philanthropic organizations or funders to encourage funding for this research, or focusing on novice researchers to consider adopting this as the career focus for their research. I mean, we need 2 decades worth of research to really get where we need to be. And was there any conversation in that area within your group?
There wasn't, because we really were more engaged in that second part of that question 1, Marla, about the credentialing impact and making that case and what stakeholders would help us to do that. Given that there was someone else, another group working on the research and data and the methodologies, we did not get into that.
I would add that we did talk about that some as far as strategic communications needs.
Hi, I'm Maureen Cahill with the National Council of State Boards of Nursing, so I think I could speak a little bit to that stakeholder group. Obviously, there are two levels here of certification that are of interest to us and that are of interest to public protection, one being the APRN group where it's mandated. And so as we built APRN nurses, we certainly built that with the ability to to pull in all the credentialing information that relates to those roles and the qualifications for licensure. RN nurses, which is also a very robust database, was not built with that in mind, but certainly could still house data on certifications. So in terms of the data repository, nurses should be something kept in mind that could potentially work. And then, obviously the perspective of the National Council and the boards is always going to relate back to the public protection part. So while there's a lot of commonality because of the consensus model in the APRN roles, when it comes to voluntary certification in RN roles, there are very many of them. We would look really for the commonality that speaks to public protection. So I asked in our group earlier today, could we say there are common threads of CUSIN or the national quality standards or other patient safety standards that run through all certifications? And I don't know that we know that yet, but that would be one way to focus research in certification that would be very meaningful in terms of public protection. And then I also would like to add that the National Council is a source of funding for research, and that shouldn't be forgotten. So I'll put a little plug in there that, if it's public protection related, so regulatory related, it's something that we would be very interested in. So yes, we would be a stakeholder.
Thank you. And I know I saw another question over here. Pat. And let's see. Go ahead.
Hi, I'm Pat Patrician from University of Alabama at Birmingham, and I was wondering, in your stakeholder group, did you consider educators? I'm thinking we're considering mandating for our graduate nursing administration programs, both at the master's level and the DNP level, making it mandatory that our students take the nursing administration certification exam before we allow them to graduate. And I was wondering if anyone else is thinking of that, doing that. I don't know what the response from the field is going to be. I'd hate to see our numbers go down, but we already monitor our nurse practitioner certification rates as a measure of quality in education. What about the other certifications?
I do want to go through and just make sure that that we included a lot of other folks in terms of stakeholders, but we followed the letter of the law. So we had faculty in academia as a part of that group. We had the insurance companies, and we also had accrediting bodies, accrediting organizations, regulatory organizations, patients and families, you name it, we think they're all stakeholders.
I just wanted to add that on the second question, we did intend to, on the first one, we did intend when we did that calling, we also did intend to query the stakeholders about research that they wanted to see done. So we did want to ask them about research questions that would be of interest to them. And I just think we forgot to say that.
All right, any other questions? Okay, group 4. Are we missing anything? Did they get it right? They did. Oh, we had pretty good consistency. I think job well done. Very good.